Have you tried everything you know to treat your lower back or leg pain and you're still finding yourself in pain? It may be because you're missing the root cause. An estimated 5 to 10% of patients with lower back pain actually have sciatica. So what is sciatica? Sciatica is a pain affecting the back, hip, and outer side of the leg here caused by a compression of a spinal nerve root in the lower back, often owing to degeneration of a disc herniation or bulge, or a spinal misalignment. In regards to sciatica specifically, the most common compressed nerve root location is in the lower back. To be more specific, the most common cause of sciatica is an overcontraction of our piriformis muscle. Now, this muscle starts at our tailbone and attaches itself onto the femur, which is the thigh bone here. The sciatic nerve can run underneath it, through it, or even on top of the piriformis muscle there. If the piriformis muscle becomes inflamed, either from sitting too long, most of the time, or from an injury or a joint misalignment, it will compress and irritate the sciatic nerve, creating sciatica. There are multiple stretches for piriformis syndrome, but I'm going to show you 3 that are very simple to do at home or anywhere that you have a chair or a flat surface to lay on. The first one here is going to be a standing hamstring stretch. All you have to do is have a chair, and if you need to balance on something, it's nice to have a wall or something there, but I want you to place whichever leg is affected with piriformis syndrome. Let's say our left leg is the one we're getting the pain shooting down the leg here. It's going to be the one we're going to stretch. So we're going to put it up on the chair. You want your other leg here to be right below your hip, right in line with your body here. I want you to stand up as straight as possible, and I want you to lean over your waist without doing an ab crunch. I want this to be nice and flat. You're going to bend right here, and you're going to feel that nice stretch through that hamstring through here. You're going to hold for about 20 to 30 seconds. No bouncing, no back and forth, just nice, good, steady hold there. And then you can switch legs there to balance it out as is, and then same thing, stand up straight and bend forward. That's the first one right here. Our next one we're going to do is a seated piriformis muscle stretch, one of the best ones we can do right now. You're going to find a flat surface. You can use a chair, you can use a table or a bench. You're going to sit down. Again, if my left leg is the one that's affected, I'm going to use it to cross it over my right, like so. You want to make sure you're sitting up nice and tall, and you want to be more towards the edge of the surface right here. I want you to, again, have that nice tall posture right here, and you're going to bend over the waist here yet again. You should feel a stretch right on that glute area right here and that hip, that posterior hip right there. It's going to stretch that piriformis muscle. The lower you go, the better. Again, hold for about 20 to 30 seconds, then switch sides and perform the other side, just to even it out. And you want to do that about 2 to 3 times right there. The last good stretch we can do is, you can even do this just waking up out of bed. It's called a knee to chest stretch right there. You're just going to lay on a flat surface here, your bed, a bench if you have one at work. We're going to lay on your back like so. You're going to literally bring your knees to your chest, and you're going to hold right here. Do this about 30 seconds, relax, and perform another set there. 2 or 3 times for each of those exercises, and that should be able to take care of most of the pain from that piriformis syndrome right there. Now, if you want any more information on sciatica, go ahead and check out our article linked above. And again, if you have any more questions, check out reachhealthandwellness.com for all of your natural health needs right there. Again, I'm Dr. Ryan, and I look forward to helping you.